from the Albert Einstein College of Medicine.
All right, good afternoon, everybody. My name is Thomas Quinn, as was introduced. I'm from the Albert Einstein College of Medicine, working in the Department of Surgery. And before I begin, I'd like to thank the American Association of Endocrine Surgeons for allowing me to come here today to present my research. Before I begin, I'd also like to briefly discuss the epidemiology of peanuts. And I don't have anything to disclose. So briefly, peanuts can be subdivided into two broad categories, non-functional and functional. The functional peanuts can be further subcategorized depending on the type of hormone that they secrete. Some examples include insulin, gastrin, VIP, and glucagon. Furthermore, the incidence of pancreatic neuroendocrine tumors is estimated to be between 1.4 and 3.1%. However, this number is rising. Furthermore, there is an MEN1 syndrome that has a prevalence of pancreatic neuroendocrine tumors as high as 75%. And also, recent research suggests that sporadic pancreatic neuroendocrine tumors may have a mutation in the MEN1 gene as well. Currently, the mainstay of treatment is surgery, with enucleation performed for benign peanuts and resection for malignant and metastatic disease. And for most of the cases, this is a curative treatment. However, with metastases, particularly to the liver, there's a 95% recurrence rate within the first 2 to 5 years following the surgery. So consequently, medical therapy is utilized in these situations, and these are some of the examples that are used. The goal with medical therapy is to increase survival, as well as to decrease symptoms. However, due to the heterogeneity of peanuts, some of these therapies are not effective in all patient populations. So there's an indication for a more robust medical therapy. So in our study, we sought to investigate the use of pasireotide, which is a long-acting release somatostatin receptor analog. And importantly, it has activity at 4 of the 5 somatostatin receptors, with its most predominant activity at somatostatin receptors 5 and 2, but also at somatostatin receptors 1 and 3. Some of the downstream effects of this pasireotide activity is not only the regulation of secretion, which is common to all somatostatin receptor analogs, but also the ability to induce apoptosis, as well as inhibit growth and proliferation. Now, this is in contrast to octreotide, which has a limited activity at somatostatin receptors, with its most potent effect on somatostatin receptor 2, which is what signifies its ability to inhibit the secretion of hormones in pancreatic neuroendocrine tumors. So, in order to study pasireotide in a peanut model, our lab used a mouse model that had been previously designed. And this mouse model uses the Cre-Lox recombination system under the PDX1 promoter, which is pancreas-specific, to produce insulinomas. And in this mouse model, at 10 to 12 months, there's a rapid increase in insulin levels, and this is an indication of insulinomas in this model. Furthermore, this mouse model has a 50%, so indicated by the blue line here, has a 50% mortality of approximately 12 to 14 months. So we used this mouse model in our experiment, and we had 8 mice, and we subdivided them into a treatment group and a control group. And they were given subcutaneous injections of either PBS or pasireotide once a month for every month. We measured serum insulin and glucose as a measure of pasireotide's ability to inhibit secretion of hormone. We used micro-PET and CT scans to monitor tumor activity over the course of the 4-month treatment. And we used histology to compare tumor size at the end of the study. Immunofluorescence was also used to observe whether or not we were able to induce apoptosis in the tumors in our mice. But before we could do this, we needed to first determine whether or not somatostatin receptors were in fact present in our mouse model. Otherwise, pasireotide treatment would not be applicable in this situation. So what we did is what you can see in this slide is that the red corresponds to insulin staining, and the green corresponds to a specific somatostatin receptor that we were trying to identify. And we found that all 5 somatostatin receptors were indeed present in the pancreata of our knockout mouse model. So with that information, we began to initiate the treatment. And before we began, we found that at baseline there was no difference between insulin and glucose in the 2 groups. And after the first injection, by day 7, there was a significant and sustained decrease in serum insulin, as well as an obligatory rise in serum glucose, which is consistent with the physiology of insulin. Furthermore, we wanted to get an idea of how pasireotide had an effect on tumor activity, and so we performed micro-PET and CT analysis looking at the standard uptake value maximum of fluorodeoxyglucose. And what this graph on the right here shows is that it compares the SUV max at the end of the study compared to the baseline SUV max. And in the treatment group, there's a reduction in SUV max by as much as 70%, indicating that there was some inhibition of activity in this mouse model. So this is one of the mice prior to treatment, and this is the insulinoma with the increased activity. This is normal tissue, the heart, kidneys, and bladder, which is they uptake the fluorodeoxyglucose as well. And this is before we initiated the treatment of pasireotide. This is the same mouse at the end of 4 months of treatment of pasireotide, and there was a significant decrease in overall activity in the insulinoma at the end of the 4 months of the study. Furthermore, at the end of the study, we collected the pancreata from all our mice, and we compared the tumor sizes in the pancreata in the control group to the treatment group. And what we found was, in the treatment group, there was a significant decrease in tumor size. This is the tumor in the one of the tumors in the treatment group, compared to the control group, and you can actually see the borders of the normal tissue expand beyond this frame. And so we found that there was a significant reduction, or the tumor size was significantly smaller in the treatment group compared to the control group. Furthermore, since pasireotide is one of the mechanisms of action is to induce apoptosis, we used a tunnel assay to ascertain whether or not apoptosis was induced in our tissue. And what you see here is that the blue corresponds to Daffy-Stain nuclei, which would be all the nuclei that were in the field. And the green corresponds to a double-stranded DNA break as a marker for apoptosis. And in the treatment group, we found that there was significantly more apoptosis in this field in the treatment group compared to the control group, indicating that we did observe apoptosis induction in our mouse model. Furthermore, at the end of the study, we looked at the overall survival, and we found that in the treatment group, all 4 of the mice remained alive at the end of the study, with only 1 mouse remaining alive in the control group. And I want to point out that this is following the beginning of the treatment. So this corresponds to the 12-month-old mice that we used in the treatment, all the way up to their being 16 months old. And if you remember, the median survival in this mouse model was 12 to 14 months. And so what we found was that we were able to prolong the life of these mice in the treatment group up past 16 months, with all 4 surviving, with only 1 remaining alive in the control group. So in summary, we demonstrated that a broad-spectrum somatostatin receptor agonist had anti-secretory, anti-proliferative, and as well as pro-apoptotic capabilities. And there was an overall increased survival in our study as well. It appeared effective that pasireotide is an effective drug in an MEN1 mouse model of insulinomas. Some further investigations include investigating the actual mechanism by which the anti-proliferation and apoptosis is induced, and also to compare SOM 230 to octreotide, and to examine SOM 230's ability on other pancreatic neuroendocrine tumors, perhaps non-functional ones. And clinical trials are obviously one of the purposes of this study, and there are currently some undergoing right now using pasireotide and malignant PNETs. I want to thank the Labudi Lab, specifically Dr. Stephen Labudi, as well as Jijay Nguyen, for their support throughout this entire experiment of mine, and also my wonderful wife for all the long hours I spent. Thank you very much. I'll take questions at this time.